Have our other guests, the other guests arrived?
Yep, they've
Jackie's gone in.
arrived.
She's Trish arrived. Yeah,
Yep,
I can
just
see her
arrived now.
today.
Yeah, thank
Lovely.
you.
Right then, let's start. So, good afternoon, everyone, and welcome to members of the Education and Children's Services Scrutiny Committee, and also to any viewers who may have tuned in this afternoon. As this is the first meeting, well, it's not the first meeting. Oh, it is the first meeting using Teams, Microsoft Teams. Please bear in mind there may be unforeseen technical difficulties. However, we will aim to keep any such difficulties to a minimum. Members, please ensure that your microphone is muted during the meeting and only switched on when you are speaking. Any members joining the meeting today using a mobile phone can mute and unmute by pressing *6. This will ensure that any background noise in your location will not be picked up through the meeting. After each item has been presented, the committee will be asked to indicate whether they wish to speak by using the raise your hand facility. Please, when you finish speaking, can you also take your hand down? And then we know that the next person's due to speak. So, introductions today. Officers that are visitors today are Trish Armstrong-Child, Chief Executive Officer for Southport and Ormskirk Hospital NHS Trust, and supporting her will be Anna Collins, doing the engagement and communications. So that's the lady who's going to take all the information away for who we want contacting about this presentation. And the other lady is Jackie Moran, Director of Integration and Transformation, West Lancashire Clinical Commissioning Group. Welcome, ladies. Start off with good afternoon. You did a fantastic presentation this morning, and this is all about our children and young people within Lancashire. So I'm sure the committee will have lots of questions to ask and give you lots of ideas of who we can approach. So item number 1 is apologies and replacements. Gary, are you going to tell us if we're replacing anybody, if we've got any apologies, please?
Yeah, that's fine. It's we've got apologies from County Councillor John Potty, and Simon Smith and Janet Hamid have also sent in their apologies for today's meeting. Replacements, we have County Councillor Paul Rigby replacing County Councillor Peter Steen for this meeting only. Thank you.
Welcome, Paul. Number 2 is disclosure of pecuniary and non-pecuniary interests. Members are asked to consider any pecuniary and non-pecuniary interests they may have to disclose in the meeting in relation to matters under consideration on the agenda. It would be helpful if members could be specific about the items in which they have an interest and the nature of the interest declared. Have we got any, please? I take that as a no. Can't see any hands up. Number 3 is Shaping Care Together programme, transforming community and hospital services in West Lancashire, Southport and Formby. A presentation introducing the Shape Care Together programme. The recommendations today are the Education and Children's Services Scrutiny Committee is asked to provide its initial view on the Shaping Care Together programme. So the ladies, I'm sure we welcome you and we look forward to the presentation. Thank you.
Thank you, Chair. So I'm Trish Armstrong-Child, and I'm going to take us through the first part of just a high-level presentation of this programme and where we're up to. And then obviously I've got my colleague Jackie from the Clinical Commissioning Group, and we're happy to take any questions or start any discussion. So thank you for the invite, and obviously it's the first time that I've been to one of the Overview and Scrutiny Committees. I've been in post 12 months. I wasn't planning the first 12 months that I had as a Chief Executive here at Southport and Ormskirk. So my ability to get out and about and meet lots of people has been somewhat hindered. So I am really pleased to be here meeting people today, albeit virtually. So Gary is very kindly going to control my slides, if that's okay. So Gary, if we can go on to the first slide, that would be great. So it's just to give an introduction really about what Shaping Care Together is. It's a programme of work that actually started within the Trust 2 or 3 years ago now, certainly before my time. And it was looking at what we called acute sustainability of the hospital services. So We know that we've got some services that we need to change, we need to update, we need to modernise. We know we've got some services that are quite small and fragile in terms of just small members of workforce. So in terms of their ability to be able to cope, for example, if we lose a post, is very difficult. So that was the programme of work that was started here 2 or 3 years ago. But what we wanted to do, and I felt quite strongly about when I took up post here, was we can't just look at hospital services in isolation, because if we change something in a hospital service, there may be an unintended consequence further down the line. And we're all about the people we serve. So it's really important that if we're going to do something, we do it in tandem with each other. So that's what the Shape and Care Together programme developed from, really. So it's not a start of something, it's just evolving from a programme of work that's been ongoing for quite a few years. But it certainly is now a professional partnership between Southport, Formby and West Lancs. Our clinical teams are starting to come together to shape how the hospital services will look, but obviously have an impact on potential community services. So next slide, please, Gary, if that's okay. So I've just talked about the importance of making sure that whatever changes we make have got the unintended consequences of making services disjointed in another area. So we need to make sure that we integrate our services moving forward. And that's extremely important for us if we're going to make sure that we've got services that are fit for the next 5 to 10 years. So next slide, please, Gary. So why Shape and Care important? So I talked before about this as a programme of work that's been going for quite some time. And when I took over in December last year, this was one of my main objectives coming in as a chief executive, to start to put some real focus on what we needed to do in this area. Now, unfortunately, nobody could foresee the pandemic that happened in March last year. So we had to sort of park things to one side while we got on with the first wave and dealing with that. But when we started, I was going to say to quieten down, but we really haven't quietened down. But in the summer, we wanted just to take a look back at the programme and see where we are. And that's why we wanted to look at why it's actually important to carry on. So I'll start from right and go to left. But so the financial issues in terms of being able to sustain ourselves haven't gone away. They're still there. And making sure that we're using our services as efficiently as possible is really, really important. The issues with the workforce and recruitment and retention are still there. And in some ways, the whole COVID experience has just exposed some of those vulnerabilities about, if we've got some smaller services, how do we think about integrating them and expanding them so we can do things better and on scale and not just within hospital walls. So it is still, the workforce issues are a very present risk for us. And clearly the growing demands of the NHS in and out of hospital services, and more so since COVID. People still talk about when COVID's over, but I don't think it's not a fact of when it'll all be over. It's about how we start to look at services differently as we move forward over the next few years. So because I've got no doubt the demands on the services may be different than they were before. And then clearly, obviously, just COVID itself. I mentioned to somebody recently that I think it's really important that some of the changes or services that we've started to change during COVID, that we don't go back. I gave a couple of examples around how well we've done in terms of some of the integration work that we've done with our community partners and our local authority, to make sure that either we keep our patients, our children, our women out of accidents and emergency. They don't need to be in there, but equally we support them in the community, but also that we're giving people other alternatives than coming to a hospital setting. And I gave an example of digital technology is one way that we've probably come in a year what would have normally taken us 5 or 6 years in terms of some of our digital technology. And that's about being able to offer people, parents, families, appointments where they can just log on, a bit like this. It's not 100% proof for everyone, but this is the kind of technology that we need to think about how we keep people safe at home and carrying on with their everyday lives if they have a chronic condition. So next slide, please, Gary. So I've talked there about some of the challenges that we face. So, you know, hospitals and GPs, you know, it's getting harder and harder in some of the areas to recruit. It's not a unique problem to this part of the country, but it's about how we think about different ways of recruiting and different roles to recruit into and bringing those teams together. And it's about, although health is improving in a number of areas, there's still those inequalities there. And I guess after COVID, that's something else to think about in terms of what does the landscape look like in terms of health inequalities. I know, although life expectancy overall has risen, there's still some unacceptable variations there. And we're dealing with a lot of people now with long-term conditions, and I include the young as much as the elderly in terms of some of those long-term conditions. Next slide, please, Gary. So the areas of focus, this comes from the original piece of work around the Acute Sustainability Hospital programme that started about 2 or 3 years ago. So what we're looking to explore is some of what we call our core services at the hospital setting and start to get some feedback. Now, it's really important that I say at this point, we're just out to the engagement process. This isn't a consultation. We haven't made any decisions on any of these areas, but these are some of the key areas that we want to focus on. And obviously services for children, particularly those with complex needs, is something that we need to consider. Just going back to my point about how do we keep children with chronic diseases safe and healthy and living as near a normal life as they possibly can in their own communities. And services for women, pregnant women, is really important. The bottom one there talks about planned care, and that alludes back to my earlier point about how do we make sure if people come in and have planned procedures with us, we can think about other ways that we can start to follow people up rather than just keep traipsing back and forwards to a hospital setting all the time, but equally making sure they've got care when they need it. So those are the areas of focus, but as I say, there's no definite plans around that. And once we've finished the listening stage, it will then be the work to start to develop those models of care. And one of the things that I feel really strongly about is it should be our clinical teams who start to think about what are the best models of care and to work with the patients. I think it's also important that I say and be transparent at this point that we can't just offer an endless sort of whatever you want we can sort of provide. Obviously, we have to do that within our own financial envelopes, but we do think that there's better, more efficient ways of doing that. So what we're really keen to say at this part of the engagement is we really do welcome the feedback, but what we can't guarantee is every recommendation or every service that people say we absolutely need that there. We couldn't guarantee that we'll be able to provide everything, but it's an opportunity of just getting a sort of a stop steady of where we are. Next slide, please, Gary. So we just wanted to map out a little bit of where we've been and where we're going. And I think that's important to have a direction both for ourselves and for members of the public, so they know the plan of work that we've got. I guess what I'd have to say at this point, and the caveat is, whoever knows now when we're living in the world of a pandemic and ambiguity in terms of when we have to stop and stall. But what we made the conscious decision of in the summer was that we would continue with this piece of work. And when we've seen the last wave of COVID that came, sort of hit our hospital services around December, January time and hit us hard, we have made the conscious decision to continue to focus on this piece of work to make sure that we get the momentum, because what I'm conscious about is whatever we decide, it's not going to happen overnight. So we need to start planning and we need to start the process properly. So what we've just described there is the sort of where we've been. And if you look back, it was 2018 when we started these discussions about developing, changing it, getting our clinical engagement. So it's been quite some years already. So the bit that we're at now is we're at the listening phase, and that's what we want to talk to you about today. And the listening phase will go on for a 12-week period. I started an engagement piece with the staff at Southport and Ormskirk just before Christmas, and I was able to engage with about 200 staff virtually, obviously, where we talked about what's coming and to make sure that staff have their say in that. But it is a programme event that will carry on throughout the year. Next slide, please, Gary. So what I'll probably pause and say here is I've been asked this question quite some times over the last couple of months in terms of, are you really sure that we should be going out and doing some listening and engagement at a time when we're in unprecedented times of a pandemic? And I think as a programme board, we absolutely recognise the risk in terms of being able to keep our own focus on this. And also the other risk is about how we reach out and make sure that everybody has the say. Because normally if we were doing listening events, we'd be opening our doors or going into town halls and inviting people to come in. But obviously in a COVID world, we can't do that. So the listening exercise that we want to do is just to talk generally with people about what's actually working well at the minute for you as a service user, what do you think needs to improve, and what's actually important to you, what are the things that you feel very strongly about. We've got on board some external support from our communication and engagement team, and Anna's on the call with us today. These are experts in this area that have done this kind of engagement event before. We thought it was extremely important that, number one, we got some expertise around this to advise us of the most appropriate way to engage with our public. But number two, in that COVID world, to make sure that we thought of all avenues and areas to think about how we get to our hard to reach populations, particularly in a COVID time. Next slide, please, Gary. So this is how we're asking people to get involved. We've developed a website that people can access, and the website is there. People can drop off their views. For those members of the public that don't feel comfortable using websites, we've actually got a telephone number, central telephone number, that people can ring that number and you can receive printed information. And we've actually got it in quite a few languages, and considering people with disabilities, to make sure that it's in an accessible form for people. And we're monitoring weekly at the moment in terms of who's currently engaging. We've asked and engaged the help of the likes of the voluntary sector and Health Watch, because we know they're invaluable in terms of helping us get to those hard to reach communities and individuals, to make sure that everyone has the say. Over the next couple of weeks, we're going to start some virtual workshops, so a bit like the setup we've got here on Teams today, so people can start to have a discussion about services and feedback their views. And this will continue, and what we need to make sure that we do is to evaluate afterwards that, you know, it's not just numbers, it's the quality of what we receive back. So we feel assured that we've got views from as many people as we possibly can, and we've gone across all the sort of spectrums in terms of the general public to make sure that views are being taken on board, particularly with those services that we want to review. So we absolutely know that the COVID brings with it risks, but I guess it also brings opportunities, because in some ways we're hoping that, you know, people will have some time to be able to get involved. Next slide, please, Gary. That's it. OK, so I'm going to stop talking there. That was a very generic presentation, but what we just wanted to deliver to you was some high level sort of timescales, but also hopefully some assurance on two things: that we have thought about a process to follow, so it is very structured, and secondly, that the thing that was most important to us was that we started this at the very early stage with engagement, because there's no point me as a chief executive having my own opinions about how to deliver healthcare and putting some plans together in an office and submitting them, because I'm not actually the service user, and that's really important. And, you know, all our experience tells us that when you engage with people at the very, very beginning, that's when you get the most effective change, and that's what we wanted to do. We know there's a lot of complex issues that have been going on in this patch of the woods for many years that haven't perhaps stopped that change happening, but that's not a reason for us not to carry on and start that change. And if nothing else, at least we're starting the conversation, and we're starting that early. So we were really pleased to get the opportunity to come and talk to you today and actually ask for some advice from your perspective in terms of if there's any other ways you should think we should be considering about how we engage with the communities.
Thank you for that, Trish. Councillors, if you'd like to put your hands up if you wish to speak, Before we start, I was on this morning's presentation, so we talked about Facebook and other things. What we didn't add on, which I tried to get over to you, but I kept getting missed, was our parent carers groups. We've got parent carers groups, and I'd like to think that they would be involved. We've got some through the county, and they're very, very proactive. They're very good, and they know what needs need to be met for our children and young people. So if you can put that on your list, I would appreciate it. If we go over to our first one, it's going to be Nikki Hennessy, please.
Surprise, surprise. Thank you very much, Chair. Thanks, Andrea. I'm glad that was top of my list about the parents and carers groups. So Sam Jones is the chairperson of that group, and they'll all already have processes in place. I don't know. Just nod if you've already contacted them.
No,
no. Okay, so
that's really useful. We've struggled. I'll be honest. We've struggled to get into LCC to find some of these groups, Nikki. So if you can help us with that, that's really useful.
You can probably start by getting, like Andrea said, getting on the Facebook page, and it'll be Lancashire Carers and Parers. And like I said, Sam Jones, I'm quite happy. I'm sure she'll be delighted for me to share with you. So, and like I said, they'll have a process already involved, where you'll be able to contact them. Now, my other key thing, because I'm a big one when I was available, to go, and when I could get into our schools. And I know for one of the first things I meet is with the schools council. And, we're talking about providing a service for children, but, you need to be asking the children. Head teachers will also be aware of if there are any children in their pupils, in their school, who are going in to, to hospital or receiving long-term care. And they should, so that's definitely a process you can get involved, and it's no biggie. I can provide you with details of head teachers, and if you could send them a letter saying, can we have a way, because they'll do it over Zoom. My granddaughter's in the other room, in a Zoom meeting, so that they can, and the teacher can talk them through, primary school as well, the fees are going in hospital, or whatever it is, how that service to support that child when they're going in hospital.
So I think we know what's happened with the schools across West Lancs is really good, Nikki, in that we've now got a council of the headmasters, headmistresses, and actually that's been really useful for us to make sure we can get out and into all of those schools. So thank you for that.
That's really good news. Yeah. So they were my main things: the SEND, special education needs and disabilities. So that'll come under our parents and carers. They'll lead on that. But if there's anything else, anybody else, so really, as a scrutiny committee, we need to ensure that communication is wide open. So with you saying you're struggling to get in, well, you shouldn't now. You get in touch with the chair, and because she'll make sure that you have links to whoever. Thank you, Chair.
Thanks, Nikki. Can you take your hand down, please?
Nikki, one of the things I would say, we talked this morning, one of the things that I'm loath to do is make some assumptions. So this morning we were talking about perhaps our more elderly population. We make an assumption that they're not really IT savvy, and then with our younger population, we think all our younger population are IT savvy and they love this kind of technology. Well, they do, but some children don't have access to it. So again, it's really important that we think of more than one way and don't make any assumptions about certain generations. So that's some of the considerations. Yeah,
and we are doing that. Sorry, Nikki, we are doing that with Health Watch and the CVS. They've got their own councils. They're helping us firstly to make a child-friendly version of our document, so that actually it's very easy to read. But secondly, they're working with us in terms of workshops, so that we can get some of those children's voices. You're right, because it's not just about going through carers and parents, it's about going to the children too.
Very much so. They're the service users. Just something came to my head. Even if you've got an engagement team to do a video or a movie of them actually, the front entrance of a child going into hospital, or even if it's just they've got a temperature or whatever, and especially now where if the parents have to wear a mask, or the nurses have to wear a mask and what have you, and understanding what they're being asked when they're in there. So
our next speaker is Ed Nash. Ed?
Yeah, thank you, Chair. I was just unmuting. It's a new phrase in these days, isn't it?
It is.
Let's all unmute. I'm quite interested. There's several, there's a very comprehensive presentation for that. Thank you very much, Trish. I'm only going to take a couple of issues from it that I saw. You mentioned that you having difficulty recruiting. Is this because there aren't those trained people about, or you're not managing to train them fast enough? Or is it that the jobs entail qualifications that not everybody has? Because there's an awful lot, there's 1 million people unemployed at the moment who could be looking at switching their careers, and particularly into the NHS, because we've all seen and we all admire what the NHS is doing. Would this not be a time to look at recruiting and training more? And I know we've got this great big umbrella hanging over us about the coronavirus and all the rest of it, but you know, it's not going to last forever, and you know, you can't have face-to-face meetings. You can't pull pensioners all together, give them a cup of tea and ask them what they think about. And it's a question of how to get there. And I know we've been looking at this on things I'm involved with. I'm on the board of the Northwest Veterans Committee, which is part of the Ministry of Defence. And we're looking at the various tiers together with the NHS of people, from older people right down to the newest, and how we actually contact them and get on with them. And you mentioned ICT as well. Have you looked at best practice from elsewhere? You're not in isolation over in West Lancs and Southport. You know, what are they doing elsewhere in the country? How do you tap together? Do you actually all talk to each other? Do you talk to your opposite numbers and find out what the problems are? These are, sorry, just questions that popped up in my head, and I'd love to hear what you think.
Yeah, thank you, and it's a great question. And workforce in the NHS is a subject close to my heart, really, because I might be biased after 33 years, but I think it's a fantastic career to recruit people into. So a couple of things I would say. So we have some of the highest medical and nursing vacancies in the Northwest, and we have done historically for a long time. Now, there are some things that we can do, and we are doing. So, for example, there's that thing around skill mix. So where you've had doctors doing certain roles, you can get advanced practitioners to come in and do those kind of roles. However, there's always the need for doctors for certain specialisms. And the other issue around nurses, I'm a great believer in giving people opportunities and local people opportunities. So over the past year, we've been working very closely with our local universities about how we make attractive offers for local people to want to come in and do courses. We're offering some of our currently unregistered nurses to go off and do apprenticeships to come in and provide training for them. So there's lots going on, and I'm a great believer that the apprenticeship schemes, which we use extremely well here, are a perfect board for people to come into if they haven't got the right qualifications at the beginning, or they haven't got the right experience. And of a nurse of 33 years, I always say if a nursing training course 33 years ago was a degree level, I probably wouldn't have done it because I didn't think I was clever enough. But I had the opportunity to go in a different route, work my way up, and I just happened to be with fantastic people that offered me opportunities. So I think that's what we can offer. So as an organisation, I feel really confident that we're doing those kinds of things and the right things to do. And some of those things take 2 or 3 years for fruition because people have got to be trained. However, as much as we do, there is still a national issue and a national shortage, and particularly around some of our specialisms and our doctors. So it's not just unique to Southport and Ormskirk, they're just not out there nationally. So particularly for us, what are the unique things? Because we're such a small hospital compared to others, some of the attraction may be that Some doctors feel more attracted to working in the big university teaching hospitals where there's lots of specialisms going on. And so what we need to think about is how do we tap into other providers and start to think about shared roles across the system. So again, it doesn't matter what hospital you work in, it matters not to a patient or a family sitting in front of you. They just want to know that they're getting the right service. So they're the kind of things that we just need to consider as we move forward. But unfortunately, we have got situations whereby if we're either trying to cover 2 sites at the same time with limited workforce, or we've got some very small services that have just got 1 or 2 doctors running them, it doesn't take a lot for them to become very vulnerable if that doctor's not available because of whatever absence that may happen. So I do feel assured we're doing everything we can in the thinking out the box, but I think there's just some national issues that won't go away in the next couple of years. And I think as an organisation, we need to be brave enough to say we can't keep doing this in isolation. We need to think of different ways and with different partners to do it with.
Is that okay, Ed?
Yeah, thank you for that, Trish. I think you're dead right when you're saying thinking out the box, and it's actually good to see you coming here. But there's my point I'm making is lots of other organisations. You might, for example, look at the way the Royal British Legion has overhauled itself in the last 5 years to be able to provide for today and not the people of yesterday, because we're always fighting the last wars and not the next one. And the same with the SAFA, which I'm on the board of, which is the Soldiers, Sailors and Airmen's Families Association, and they've just gone through a massive overhaul of the whole of their systems, and they used to provide nursing sisters through the whole of Germany for the troops, and they found out in both ways that they were fighting yesterday, and so it's a question of looking for tomorrow. And also the last one I'll leave you with is how do we actually get the message over? Because you mentioned old people don't always look at these sort of things. And there's old people like me that have to when we're on the county council. You know, how do we get it over to them? How do we tell them all? Perhaps Lancashire County Council can put stuff on its website for the NHS to actually, when people are looking to do something else, and the same at district level. But I'll shut up now or I'll end up going on forever. Thank you very much for coming today.
Thank you.
Next we've got Councillor Jimmy Eaton.
Thank you, Chair. First of all, thank you for an excellent presentation. Me and my wife, we have a couple of relatives who work for the NHS, and we are aware of lots of issues. Councillor Nash actually stole my thunder. I was going to ask issues with the workforce, recruitment and retention. Well, that's been addressed. But I've great admiration for what they're doing with this COVID-19 now, what's going on. There must be a real strain on all the staff, and credit to them. But also there must be a financial pressures with the NHS. I'm just wondering if you'd like to enlighten on that, please.
So we found ourselves this year in terms of the finances in a very unique position, because what happened from a national perspective is we were funded in terms of whatever we needed. We were just so this year there's been a lot of help and support for us in terms of being able to finance what we require moving forward. I think as we come out of this, some of the other things that we need to consider is the recovery of the NHS. It's going to take a long time to recover. And if I think about one of the things I'm very proud of is despite COVID, we never closed our doors to people who didn't have COVID but still required services. And that was a message we were very keen to make sure our local population knew. However, we did see a drop off at one time in people either coming, attending hospital, or when surgery was postponed for quite some time. So I think we're going to have to really think about how we do things in the restoration and recovery of the NHS, because I don't think it's something, I think we would be naive to think that in a year's time everything's going to go back to normal. So we're going to have to think of our workforce, and we're going to have to think about our finances. There's been no sort of decisions nationally on our finances moving forward. What we're in at the moment in terms of what we need to spend, we can spend, but obviously have to prove that we're spending it efficiently. Is really important. But again, as a chief exec, I feel confident for the past year that there's nothing we've been unable to do because of the finances, because that's been made available to us. But moving forward, that's something I think we just need to go back and consider once we know what the financial envelopes are going to be.
Thank you. Just to carry on from there, is you talk about how we're going to get people back to hospital. I think seems to get a lot of people now are frightened of going to hospital. I mean, my wife's waiting to have a new hip in, but obviously that will be put on the back burner for now. But I've spoken to quite a lot, especially the elderly. They're frightened of going to hospital for catching something, and you can understand that. But how we address that, I think it's going to be very difficult. You've got something which you need to look at and address this matter to convince them that it will be addressed and they're safe when they come into hospital. Thank you.
Thank you.
Okay, thank you, Chair.
Thank you, Jimmy. Can you take your hand down? Thank you. Next, we've got Stephen Clark, Councillor Stephen Clark, from his hospital bed.
Well, thank you. I just thought to actually come in onto this one because I've just had a hip replaced yesterday, which has been absolutely superbly done. But actually on the National Health Service, but I should have had it done in March, and then it was basically cancelled because of COVID. And I've come in, but they've actually not done, although I'm National Health, I've been done in a private hospital, which has been absolutely superb. So it just proves that things are done. I do hope you do get on with your scheme. It looks very good, and I do appreciate what you're trying to do. But talking about hospital staff and everything, all I can say is when you actually get into these places, they are absolutely superb and do everything. I have one daughter who already works with the National Health. She's occupational therapist at Blackpool Vic, and she was even saying how strong, how bad it is staff-wise. You hit a point there which is very, very good. I had one daughter who was going to go into nursing, and she had to go to UCLan to actually do a training. She got into right towards the end of the second year. She just found out she couldn't pronounce some of the drug names and things like that. Mm. And because of that, she dropped out of the course, and she's now just gone into care in the community. And you're right, some people are really fit to be good nurses and everything, but this training nowadays to basically get a degree to be a nurse seems a bit too far. And I think that's where we need to train people the old-fashioned way and bring them in as like an apprenticeship rather than having to have a university degree to do it. Okay, thank you.
Thank you. Oh, go on. Sorry.
Sorry, I was just going to reply to that. I think over the years, what I would say is the nurse of the role of the nurse over 30 years, is obviously in my time, has changed dramatically. And I think back to what I was doing 30 years ago to what I was doing in advanced practice, and going back to the point of there's a lot of things now that nursing staff are doing in advanced practice that the doctors used to do, and all that skill mix. So I do actually think it's important. And I think about my 3.5 years of training. I didn't get a degree at the end of it, but actually it was hard academic work. So I think it's good that it's been acknowledged, and I think it's good that we do train our nurses to degree level. But I absolutely agree. It's about how do you make this something to aspire to if you're the 14-year-old kid who's struggling at the time for whatever reason, either academically or socially, but has got all the attributes to come into the healthcare profession. And I think that's absolutely key. And I think we've got a responsibility in all our communities to make something. And if somebody told me 33 years ago that I was going to be a chief executive officer, well, I don't know if my mum would have quite believed it. So there's something about how do we make this in small bite sizes achievable for people who don't think they can achieve anything.
So can I come in there, Chair, please? I just wanted to sort of talk about what we've been doing previously with West Lancs College. So you know, we've been trying to work as a partnership to get a pipeline, really, and this won't solve Trish's problems with her vacancies, not yet anyway. but to try and get some of those children that don't want to necessarily go on and do A levels or go to university, to try and get them into health and social care. So we've done that with West Lancs College. We've developed that. We've also, for those that do, we've brought A levels back to West Lancs College, and they've now got a scheme for children who want to get into healthcare and want to go on. They can do A levels there and then maybe go on to Edge Hill if they want to. Edge Hill as well, their course now is focused around GPs. It's not training doctors necessarily to go into hospital, but it's training GPs that we need in our community too. So I suppose it's about having entries at all of those points to deliver the workforce at all of the different areas. And the one thing we're trying to do with the grassroots level is not just to train them for health, to train them for health, for social care, maybe even for the leisure and the leisure side of things as well, to try and get them in and get them engaged. Because we recognise in Skelmersdale, there are pockets where they haven't got the aspiration, but actually they've probably got the ability. So it's just to create the opportunities.
Thank you. Councillor Cheetham, you've been up and down with your hand. Did you want to speak? And you're on your mics.
Yes, I'm back. I'm back with you. Yes, I'm just going back to young children and obviously our colleagues, and we as children's services, etc., are responsible for a great number of children up until the age of 18. But I am concerned, obviously, as we have all been affected in different directions concerning COVID, and I think children perhaps more than we fully appreciate. And I'm very concerned about those on the sort of the 14 to 16 age groups. Just listening to sometimes conversations of young people walking near to me who are getting very anxious and are very uptight and they're missing something. And I know, and I'm never quite certain who's actually responsible for this, whether it comes under family services or, I mean, I'm of a generation where we used to have a school nurse, who you could go. Now we have what we call pastoral staff within schools. But I'm very much concerned that we encourage, and perhaps through your good offices in your part of the world, that we can get perhaps more people interested as mental champions within the schools, which we've been asked to consider in other aspects within local government. But I am concerned that perhaps some youngsters are having some very great difficulties, which perhaps have not hit us yet, but could do within the next couple of years. And I was delighted with the conversation concerning Edge Hill, which of course we're all familiar with and know how much good work that they have done. And I can appreciate sort of the attractions of the big city, Liverpool just being up the road. But as somebody who was born in Southport and did start my education in Southport, you're sort of trying to think, in my time, possibly there weren't quite the same challenges, but I am very much more aware, and because of social techniques within our computers and everything else, I can see more children becoming isolated and then getting themselves all knotted and twisted. Whereas if they could have an outlet, and I'm delighted that my colleague has raised one or two things, and certainly I was involved on foster caring on the other side and picked up quite a lot with teenagers that came through our hands. But it's just being concerned about the mental capacities and how we can help and reach, and perhaps there might be one or two organisations in the area who might be able to act as mentors or also as health mentors, but not necessarily more as listening posts than anything else. But I am concerned about that 14 to 16 age group at this time.
Thank you, Councillor Cheetham. Next, we've got Councillor Matthew Salter. Anne, can you take your hand? Oh, you have done. Thank you.
Thank you, Chair. I've very much enjoyed what we've heard so far and been very much impressed with it. I wanted to ask, to what extent is there a problem with young people, and I suppose perhaps young men especially, not seeking healthcare or going to their GP early on if they do have some sort of health issues, and resultantly, does that create a problem?
The numbers
with
on my card.
Does that create a problem with, some people turning up at A&E or whatever, who perhaps could have visited their GP earlier on? And is that something that's sort of worth picking up on?
Trish, do you want me to answer that one?
Do you want to start? And yeah.
So I can't say at the moment, Matthew, whether young children are not accessing GPs and waiting longer. What we can see in West Lancs is the number of children that are turning up at A&E in West Lancs is significantly higher than other parts of Lancashire. And I suppose that is indicating to us probably we haven't got sufficient services out of hospital for children that probably we need to develop. But I suppose that's one of the reasons we want to do this listening exercise. That's my assumption. I mean, if I think about Alder Hey and what happens across Liverpool, everybody knows that Alder Hey is the children's hospital and everybody goes to Alder Hey. We've got a children's A&E currently in Ormskirk, and therefore I'm sure it attracts children. I do believe we could probably have done something more out in the community. So that's what we're here to listen to, I think, really, Matthew. I don't know that people are turning up too late. I'll just give you some reassurance of that.
I was also thinking in terms of perhaps, like late teens or early 20s, people in that sort of age group. Is there an issue with that?
I'm not seeing it. I am seeing what Anne's talking about, and I'm hearing that sort of the mental health issues at the moment are things that are being seen across the system, and that we're needing to wrap services around, you're right, later teens as a result of that. But I'm not seeing the numbers attending A&E, maybe that you're suggesting. Trish, I don't know if you have any numbers.
I mean, the only comment I would make is certainly as the first wave of COVID started to ease, we saw an increase of younger people in crisis. Yeah. So what we've not been able to do the analysis on at the moment is that purely to do with COVID, or has there been underlying issues that have gone undetected and COVID's been the factor that's pushed them into crisis? So I think it's a good point. I think there's more work that needs to be done, certainly in terms of physical health. If there's, if we get people that are presenting too late, and you'll recall over the years, there's been lots of, national cancer campaigns about coming into checkups, and there's been lots of screening campaigns. I think that's helped with raising awareness, particularly for younger people who would probably think, well, I'm too young, but actually I recognise symptoms. So I think we've seen some of that, but I think in terms of sort of, if we think about child mental health or transitional mental health, people in that 14 to 17-year-old bracket, we did see a higher increase at the beginning of the COVID lockdown, but I don't think that's unique to this part of the world. I think that's been a national issue.
Are you okay with that, Matthew?
Yes, very much so. Thank you.
Right, so it's said today that visit our interactive engagement site to upload stories, share ideas, join forums and complete our survey. Going back to Anna, I know she's there somewhere. Is it AC, Anna? So on your list for engagement today is how do you engage with young people? So we've said about Facebook. Maybe having a poll so people can look at some of your questions and do a voting poll on Facebook so they can respond. And that is also with school children in the high schools or universities, colleges. How do they see the perception of what you're trying to offer? What were their views? Do they think they'd engage with how you're going to do it? I've mentioned the parent carers groups. We've also got corporate parenting board, where we've got a group of young people that have been in care or are still in care. What are their views? How do they feel? How do they interact? Because if our people guide them, but they're going to go out into the big wide world, how do they feel? Foster parents, people, you know, the engagement when they're taking on our children in Lancashire, we want to make sure they get the best. What are their views and how do they move forward? Because it can be quite awkward when you've got a child, you're saying to them, have you got this, have you got that, how do you feel? How do we move forward with them? You could set up groups. We've got school council, and we've also got the youth council at County Hall. That'd be good to engage with them and have a poll through them. Local newspapers, they could run you something in the papers and put you something for them to contact through a poll through the paper. Doctors, surgeries, dentists, sports clubs, football clubs. With the football, they're out in the community engaging with young people all the time. They've got funding and they engage with like a sporty type, but there's lots of mental health in sports clubs at the moment. With the rise in mental health, you know, how we're going to master it, what's going to happen. The children for the last 12 months and this year coming up with exams, they're frustrated, the parents are frustrated. We're going to have to look at things a lot different. So those are a few of the ideas I slotted down. If you need me to do them slower or send you a list, that's fine. But councillors, can you think of anything else that I've missed out? How we engage with our children and young people in Lancashire? That's what we're supporting. How do we engage? Any ideas? Quick, get your hands up. Matthew, you should have some being at uni. You're still there, aren't you?
Well, you've put me on the spot now.
Well, just think, this is being delivered to you. What could they do different as you as a young person?
Whilst you're thinking, Matthew, can I respond? We've
Hey, Anna, can see you.
Hi,
now.
Can you see me? So some of those channels that you're talking about, we're absolutely already thinking about. So some of those Facebook groups and working with the community and voluntary sector in particular to reach the children's and young people's groups that we know exist. But you've added a good list to my shopping list, which is fabulous. I would like to just test an idea on you all as well that we've been having, which is about encouraging young people to create their own content. So this is in technical speak called user-generated content. So we'd be asking young people to do videos and upload them, or maybe do stuff on TikTok or some of the platforms that we know that younger people use, where they can share their stories and experiences. And we can do that through our website. So what we need is the mechanism, though, to tell them that we're going to ask them to do that. So there's some of the things you've talked about, which are sporting clubs and parents and carers groups, and I didn't know about your youth council, so that's brilliant. What we want to encourage young people to do is get creative about this, and also because they influence the members of the household, don't they? So if they said, hey, Gran, you know, let's sit down with the tablet and I'll help you to do the survey, wouldn't that be brilliant too? Intergenerational stuff. So sorry, I was just filling a space for you there, Matthew. Carry on now.
Just before he comes in now, about doing a competition within the high schools in the areas you're covering for them to design something or come back. So if they think they're going to get something out of it through the school portal of a competition, they would want to take part and come back with the feedback. And I think you get a lot of feedback from that.
I think that's a brilliant idea. And if you would allow me to consider when the best time might be to do that, because it might be best when we do the formal consultation later in the year, where we're actually asking them to decide between things. So at the moment, we want to encourage them to tell their stories about what works well, what needs to be improved. But when they've actually got to influence commissioners' decision making, I think that's an awesome idea.
And the youth voice is very powerful.
Oh yeah, absolutely. Yeah.
Right, Matthew.
And they're the people that are going to care for us, aren't they?
They're our future, yes.
Yeah, we've got to look after them.
Well, this is the youngest member, I think, on our panel. So, Matthew, come on.
Oh, right. I don't know what's happened to my video. Oh, right.
You look even younger there.
I'm back. Yeah. There we are. So just, I guess, a few things I would say. I agree with sort of engaging with whether it's sports groups, social groups, all those sorts of activities. I think there's a lot of value in that. I think in terms of social media, I was going to say actually young people are moving towards social media such as TikTok, and whatever. The problem is the easiest social media, I think, to engage with in terms of getting out a public health message, certainly in terms of getting out political messaging, is Facebook. And yet, I mean, some people would argue that young people are less engaged with Facebook than they used to be. I mean, certainly, I think that is where you start if you want to ramp up your social media efforts. And if you can have content that is easy to share, you'll find it will start to get shared on local Facebook groups and local Facebook community groups that will be seen by all sorts of people, even that you wouldn't necessarily anticipate. So I think that's the easiest in terms of getting kind of impact quickly. But I agree, if there is anything that you can do to get onto the newer forms of social media, I suppose Instagram and TikTok particularly, then go for it. I think one of the issues for young people is going to be probably not knowing, or it might sound really odd, but not being sensible when there does start to be an issue of thinking, right, well, maybe I should speak to so-and-so or go and book an appointment for this or that about it. And I think a lot of young people will start searching online and will think, oh, I've got certain symptoms. They'll look something up. They'll come across some awful condition on the internet and start sort of catastrophizing about it. And so again, so the thought of, well, how do we make sure that people know that actually, you know, you have a conversation whether with a GP or with some figure who would actually know a little bit about it, rather than perhaps panicking and thinking, oh, I've got this or that. But certainly, I think that it sounds like there's sensible sort of ideas, and ultimately it's an engagement, and we need to hear from young people in terms of what they need. I can't speak for everyone, and although I may be the youngest county councillor, I'm somewhat older than, you know, even the new generation that are coming through. So we have to be aware that it's a constantly changing picture. But anyway, I suppose those are a few thoughts. Whether that's helpful or not, I don't know.
It's very, very, very helpful, Matthew. Thank you. And if you want to start the Shaping Care Together TikTok dance, I'd be very grateful.
Good idea. I'll think about that.
Next, we've got Nikki Hennessy.
Yes, definitely Instagram. You know, I think what we know is the young people don't look at Facebook. That's for us old codgers, really, isn't it? Definitely Instagram. And, you know, a Marcus Rushford of this world in Lancashire, if you've got somebody as a local celebrity who can help do the video on Instagram, you know, in partnership with you, you know, that will go for miles.
Ooh, maybe have to see if we can get a local footballer, something like that, to help us.
Local celebrities all together, because not one person suits everybody. So have a selection that they're all
very true.
peas to. Yeah.
Yeah, try Lee Mack, the comedian. He's from Southport. He's very pro.
Yeah, I didn't know that.
Right, ladies, any more questions? Councillors, any more questions? Oh, Nikki, you've got another question? Or is that you going down?
Yeah, that was me going down, but I was just thinking, you know, the amazing Amanda Gorman, you know, at the inauguration of Joe Biden. We need a poet, don't we? Because I think it's definitely, well, it's rap to the kids, isn't it? But we need something like that to really engage them. So maybe that could be part of your competition, because it's English, isn't it? You know, and Get them all involved.
That's what we need, a competition. They all like to win something or be with the celebrity. And that just takes it on. And next, Andrew Gardner, you were up and down. Are you coming forward?
Yes, Madam Chair. I was only going to suggest Scott McTominay of Manchester United. He lives in Lancaster, and at the moment is quite a big celeb. And actually, if you're talking about Marcus Rashford, maybe Scott may be interested. And I do have a possible link to Scott as well for a friend.
So you ladies, you've got Andrew's email, haven't you? Well, it's Andrew Gardner, andrew.gardner@lancashire.gov.uk. So I'm sure you've got some really good ideas today, and we look forward to hearing from you in the future. And we thank you for coming on and giving us the inspiration of the future of what's going to go on with the NHS. And hopefully this will go out throughout the whole of Lancashire. I'm in the Blackpool Fylde area with Ed, and we are definitely Luke and Steve, who was in his hospital bed. So we will definitely be looking forward to the future. So I thank you all for coming on.
Thank you.
Thank you.
Thank you, Chair, and all stay safe.
Thank you. Bye.
Bye.
We're moving on now, councillors, to item 4, any urgent business. There isn't any at this moment in time. And item 5 is the date of the next meeting. So the next meeting is on Tuesday, the 9th of February at 10:30. That's a week away. So I look forward to seeing you all then. Keep safe, keep well.
Thank you, Chair.
And I
Cheers.
hope you've enjoyed
Madam
that
Chairman.
meeting.
Yep. Cheers.
Thank
Bye.
you for
See
an
you next week.
interesting afternoon, Chairman.
Thanks,
Thank you.
Chairman.
Thank you.
Thank you.
Bye.